COVID has really forced us to modify the way we provide care to veterans. Some veterans have had appointments canceled, modified, changed, postponed, different modalities as we keep changing our ideas. Others have had to rely on virtual care options. However, some cannot stop their normal care even in the middle of a pandemic. And that's true for our chronic dialysis patients that get their care here at David Grant Medical Center. To talk about how we've made that work during COVID and the quality care we continue to provide to veterans, I'm here with Kim Green today. So Kim, thanks so much for joining me.
Thank you folks so much for having me.
Kim is a dialysis tech at our clinic here that we share VA DoD clinic at Travis Air Force Base. And to learn how they've continued to perform life-saving dialysis treatment for our veterans despite the challenges of the pandemic, you're going to share some things with us. So again, Kim, thanks for joining me today. Why don't we start by you telling folks who you are, how long you've worked for the VA, and what exactly is the job that you do here?
So I'm Kimberly Green. I'm a retired Air Force Tech Sergeant. I've been here at Travis since 1992. With the VA, I've been working here about 9 years, 5 years in my current position as the lead medical instrument technician for hemodialysis. I was actually part of the planning stages of the joint venture for the VA and DoD to get together to make this wonderful unit that I work in.
Yeah, well, that's a long history here at the David Grant Medical Center and then in combination with the VA. So thanks so much and thank you for your service.
Thank you.
How has the pandemic affected your ability to provide care to veterans?
So we actually have provided seamless care. From day one, when everybody started to shut down, we were one of the very few clinics that were open. We had to ramp up some of our services because we knew the fact that renal disease was one of the final stages of what COVID would lead to, is how it was seen. And so we wanted to make sure how we could protect our patients, protect our staff, and making sure that we could provide treatments without any hesitation, be it whether they were getting here for their appointments through transportation. So we worked with the VA transportation services, making sure our patients could get here. We had set up and designed certain rooms, both within our chronic and acute area, to where we could provide patients care directly in their room. So they didn't have to leave. If they were admitted with COVID symptoms, we could go ahead and we could treat and manage everything there right at their bedside.
Mm-hmm. So it's so important when care can't be stopped, even though there's a pandemic, and finding a way to make it work. Even the logistics and the transportation when nothing's running is just tremendous. What are some of the precautions that you take to be able to perform dialysis safely? And has any of that changed because of COVID?
So most definitely. So our screening processes, our patients arrive here very early in the morning where the group isn't actually open yet. We are the only outpatient clinic on this side of the facility. And so it's making sure that our patients were screened prior to coming in, where you have your checkpoints throughout for temperatures and COVID symptoms. And so we also screen our patients prior to admitting them into the clinic. And so that gives us a view to where if they needed to be tested or anything like that, we had the ability to get all that taken care of before they received their treatment. PPE, of course. Mm-hmm. Like I said, we staged different areas for patients. If they had symptoms, we still would manage their care. We would provide rapid testing and then manage their treatment in the dialysis unit.
What are some of the concerns patients have had? So these are, immunocompromised patients getting chronic dialysis. What are some of the concerns they've had because of COVID?
So most of the concerns was, again, transmission. And so, making sure that everybody was still doing what they were told. Everybody, masks, our proper PPE, having shields on, because we're exposed not only to COVID, we're also exposed to blood products, being in dialysis. And so it was making sure we would manage their pod through disinfection. We had actually came up with an idea to put shower curtains between the stations for no transfer of anything and easy cleaning versus the plexiglass.
Yeah, I've heard of shower curtains in other areas of healthcare as people were trying to scramble with some of the PPE, so very creative. Where would a patient go to learn more about dialysis treatment here?
So that's one of the nicest things. So here in our unit, we offer a chronic kidney disease course. It's one-on-one or group, depending upon the patient's need, and it's open and available to veterans, military members, family members, caregivers. With that, we talk about everything that they need to know about dialysis, the different treatment modalities that they have, renal nutrition, we go over their medications, we go over transplant services, all those type of things. They can also get in touch with the National Kidney Foundation, which I can give you the website number if you want that. And
Yeah, we can just put that on the bottom of the screen here, and we'll get that for folks to be able to reference.
And then also the renal network, Network 17, which is all Northern California, which can give you information on managing dialysis and just kidney stuff in general.
Well, that's great. Have we done any virtual, so these classes that are one-on-one or with groups, have you been able to use virtual technology during the pandemic to still connect with patients?
Mostly on the nephrology side of the clinic, the physicians and our renal nutritionists that we have, because we offer many services in the clinic. We don't just treat the patient for their dialysis. We have a social worker for our unit, renal nutritionists, our physicians, our nurses, all our staff. And so any patient could call. Our renal nutritionist was doing appointments via phone for any questions that they had.
That's great. Well, thank you, Kim. And I just want to say, I was talking to Kim before the video started, and she chooses to commute multiple hours every day, even though there are dialysis clinics right next to where she lives, because the quality of care, the giving back to veterans that are in need, and just seeing how we're delivering care far better and above and beyond what she's seen in the community. So, Kim, thanks for your dedication, thanks for your service, and thanks for taking a few moments to talk to us today.
Thank you. There's no place I'd rather be.
I want to remind folks that we're offering COVID vaccines to all veterans, all caregivers, all spouses. They can either walk in at the 11 sites that we're providing COVID-19 vaccine, or they can call 1-800-382-8387 and choose option 8, and we'll schedule them in the not too distant future for their COVID vaccine. So thanks everybody, thanks for caring for veterans, and we'll talk to you again next week.